live on Mr. Wood Studios. My name is Mr. Wood. Today, we have an episode for breast cancer, and we have a lot of misconceptions about breast cancer. That's why Dr. Mrs. WIAFE ADDAI, the president of Breast Care International and the CEO of Peace and Love Hospital, is inside the studio here. Good morning, madam.
Good morning, Mr. Wood.
How are you doing?
I'm fine, thank you.
It's a great day we have you here.
It is a pleasure to be here.
Thank you very much. Doctor, you have a lot of experience in the medical field, and breast cancer is one of the main challenges, especially for the women. Someone will ask, what is breast cancer?
Thank you. Breast cancer means cancer that has started from the breast. Every organ in the body can develop cancer, but breast cancer happens to be the most common cancer globally, and it's the #1 cancer that kills a lot of women. It can also kill men, but women are the most common culprits when it comes to breast cancer. Cancer means an uncontrolled growth of cells. Normally in the body, there is a limit at which cells can grow. They grow to a certain limit, they die, new ones come. But when there's cancer, then the body loses its control over the division and the growth of the cells. And so when that happens in the breast tissue, then it's called breast cancer. It could come from the ducts, it could come from the lobes, or any parts of the breast. So when the cancer started primarily from the breast, then it's called breast cancer.
Are there any factors that increases the risk of breast cancer?
Yes. To start with, let me say that we still do not know the exact cause of breast cancer. We don't know the cause of breast cancer, but we know of risk factors that are worth noting. These happen to be a woman. Once somebody is a woman or the female gender, the person is already in the risk group. Positive family history. And there's something we call hereditary, when there's genetic mutation in the system, it can cause breast cancer. So if, for example, we take 10 breast cancer patients, one of them has a positive family history. So genetic mutation or hereditary is a factor. Parity, women who have never delivered before are known to be in the risk group. Women who are elderly primates, those who had only one child and had that child after age 33, are also in the risk group. These are risk factors that we cannot change. Okay. Or women who have had a lump in their breast before, we cannot change them, but there are some factors that are factors that we can do something about, okay, like excessive alcohol consumption, cigarette smoking, including the use of shisha, okay, a lot of fatty intakes of food. So, and we also know about the use of chemicals like the skin lightening agents, okay, and the hair relaxing agents. Some of them unfortunately contain chemicals that are known to be carcinogens. Lack of exercise is also known to be a risk factor. Okay. So those are modifiable risk factors, apart from the risk factors that we cannot change.
Okay, so you mentioned men and women when you were introducing breast cancer.
Yes.
That means men also affected by this disease.
Men also do get breast cancer.
So with this, at what age should men and women start going for breast cancer screening?
Okay. In some countries, some of the high-income countries, they have what they call screening mammography. So they have systems in place. For example, if a woman is in the US, when she's 40 years, she's called that she should come and do her baseline mammogram. She should start having her screening mammography. We do not have screening mammography as a system, but we advise our women to start with their breast self-examination once the breasts are formed. So for some young girls, by the age of 11, 12, already they have good breasts. So they should start doing their own breast self-examination or start knowing how their breasts look like and how they feel like. There are different types of screening. So breast self-examination is one type, and that's the one we want women to start doing as long as they have breasts. The other one is clinical breast screening. That is done by trained personnel. So if we had our way, so if for breast self-examination, we advise women to do it every month. For clinical breast screening, we advise women to have it done at least once a year. We also have screening mammography or diagnostic mammography. So for mammogram, because for the black woman, our cancer strike earlier, we want our women to start having their mammogram from age 40. If someone has a positive family history and she has delivered before, then we can advise her to start from age 35.
That's good. What are the common signs and symptoms of breast cancer individuals should be aware of? Thank you.
Normally, when we talk about the classical signs and symptoms of breast cancer, we are talking about the lump, we are talking about dimpling in the skin, we are talking about flattening or inverted nipples, we are talking about abnormal nipple discharge. But let me state here that if we talk about a lump in the breast, depending on how big or small, it could also mean a late-stage disease. So we don't want people to sit and wait for the classical signs like dimpling or flattening of the nipple or inverted nipples. Those can mean that the disease has been there for long, and so it's no more an early-stage disease. So if we want to identify early-stage disease or diagnose early-stage disease, then we need to start with the screening methods that I mentioned, the breast self-examination, the clinical breast screening or mammogram. Those are the screening tools that help us to identify breast cancer early.
Thank you. We are live on Mr. WOODE Studios. Don't forget to subscribe to the channel, share, comment, and like. You can also visit us on MrWood.com. Doctor, sir, can stress
increase the risk?
Yes.
Yes. So when someone is under stress, especially under long periods of stress, that can reduce the immunity of the person. And when immunities are low, the chances of the person developing cancers is high. So if someone will be under constant stress or long periods of stress, then the chances of her developing breast cancer can also increase. So we cannot live without stress, but we advise people to, as much as possible, to do away with some of the stress. You can't solve the problems of the world. So let's try to move away from some of the things that give us a lot of stress.
That's great. Doctor, exercise have any role to play in the prevention of breast cancer?
Yes. Breast cancer happens to be one of the non-communicable diseases. And lack of exercise is one thing that has been found to be risk when it's a risk factor to the non-communicable diseases like breast cancer, prostate cancer, cervical, and all the other cancers, and as well as the non-communicable diseases like hypertension, diabetes, mental health, and the other common non-communicable diseases that we have.
Okay, most people have misconception that breast cancer is a spiritual disease. Is it true or not?
It's not true.
Okay.
Breast cancer is found in every country.
Okay.
In America, in Europe, in Asia, in Australia. So can we also say that the women who are diagnosed with breast cancer in America or Europe are also being affected by spiritual things, and people also think it's caused by witchcraft? And because of that, in fact, that's one of the reasons why a lot of our women are able to stay for so long without going to the hospital. Because once there's a problem with the breast, our women want to go through other means, you know, like removing the witchcraft, or going to see spiritualists who should remove the spiritual aspects. But what we advise our women is, we all believe in prayers. So if you find a problem, let your pastor pray for you and you go to the hospital. Because if you don't go early and you keep staying at home for a long time, you allow the disease to spread. If breast cancer wouldn't spread, it wouldn't have killed anybody. But because of the fact that it's as a characteristic of a malignant lesion, it can spread. And for breast cancer, the target organs are the liver, the lungs, the brain, and the bones. And so the more you allow it to stay in the breast, the higher the chances of it spreading.
That the only treatment for breast cancer is cutting off the breast. Is it true?
It's not true. There are two types of surgeries that can be offered when the woman is diagnosed with breast cancer. If the diagnosis is done early, like stage 1 or stage 2, then we can preserve the breast for the woman. So despite the presence of breast cancer, a breast conserving surgery can be done. And so the tumor will be removed from where it's located and the breast will be preserved for the woman. In the developed countries, more breast conserving surgeries are done than mastectomies. And even now, when you come to the Peace and Love hospitals, and we have one in Accra, one in Kumasi, we do more of breast conserving surgeries, more of the wide local excisions than mastectomies. Our women are scared of mastectomy, and so a lot of the times they run away from the hospitals. But if you want us to preserve the breast for you, then you have to come early.
That means Peace and Love Hospital are specialized in breast cancer care.
Yes, it started as a breast cancer hospital, but with time, the hospital has grown. And so we have the gynecologists who handle cervical cancers, endometrial, even we have the obstetrics department where cesarean sections and normal deliveries are done. We have the dialysis unit where people with kidney failures are put on the machine. So we have the dialysis unit. We have the urologists who handle prostate cancers and sexopathology. In fact, it's in our hospital that we started doing penile implants for men who have issues with potency. So our consultant urologist is the first Ghanaian urologist who started doing penile implants.
That's great.
Yeah.
Where can one locate Peace and Love Hospital?
So Peace and Love Hospital in Ashanti region is at WOODE in Kumasi. And in Accra is on the Spinters Road behind the Zenith Bank.
Is it possible we can get their contact in case someone want to call them?
Yeah, for Accra is 0244 099 140.
Okay.
0244 099 140. And in Kumasi is 0244 145 064.
Okay.
0244 145 064. You can also Google and you get the direction to the hospitals.
Thank you, doctor. What are the supporting systems available for helping breast cancer patients in their treatment and their recovery journey?
That is a huge problem we have as a country. And probably it's not only for breast cancer. Those of us at the Ghana NCD Alliance, and I happen to be chairperson of the Ghana NCD Alliance, we've been trying to lobby or advocate that patients with chronic illnesses, patients with stroke, patients with cancers, patients with mental health conditions should be supported in a way, should be helped, especially when they are going through their treatment journeys. When you go to other countries, there are supporting systems where a patient can approach and get some support for the treatment, the initial treatment or their management as they move on with their treatment in their treatment journeys. But we don't have any social support system for our patients, and that is not acceptable. We should think of how to help our people, especially when they are diagnosed with one disease or the other, whether it's breast cancer or prostate cancer or stroke. It shouldn't be left to the patient and his or her family alone. And breast cancer strikes earlier, so majority of our patients have young children. And so when the disease strikes and they have to use all their capital to take care of themselves, the children are left alone and some of them drop out of school. So we need to have systems where we can support such patients and their families.
You are watching Mr. WOODE Studios. We have Dr. Mrs. WIAFE ADDAI, the President of Breast Care International and the Chief Executive Officer of Peace and Love Hospital. You can visit us on mrwood.com. Don't forget to share, subscribe, and like. Doctor, most of young women, and including men, are afraid to go for breast cancer screening due to the stigma. Do you have any message for those people?
We have a lot to say to such people. Unfortunately, it's true. Breast cancer is surrounded by a lot of misconceptions, and the negativities around the disease brings about a lot of stigma and fear. This is a disease that does not arise by any fault of yours. So why do you feel shy? Why do you keep the disease to yourself alone until it's too late? So we are lucky to have a lot of breast cancer survivors who have come out to share their stories, to expose their scars and their prostheses, and to actually let people understand that the diagnosis of breast cancer is not equal to death. So these survivors are helping us to reduce the stigma and the fear surrounding the disease. We want our women to be breast cancer aware and not scared. If you keep the disease until it's too late, then obviously there's not much we can do to help you. But if you've identified something, if you found a lump in your breast, if you found some abnormal discharge, if you found some dimpling in the skin covering your breast, or some flattening of your nipple, or inversion of your nipple, please come to the hospital. Don't stay at home and say you don't have money. If you come early and there's something we can do to help you, we will do to help you. But if you come late, then it becomes very difficult to help, because when the disease is late, it's very expensive to treat.
Okay, thank you, doctor. Do you have any successful story to share with us that some of the patient has been fully recovered, so that you can put hope and trust in the patients who are suffering from breast cancer?
You need to just come to any of the activities we will be having, and in October we are going to have a lot of activities. On the 12th of October we are going to work for the cure at Ejiso, and that's the time we showcase survivorship. We have close to 1,000 breast cancer survivors in Ghana, and some of them have come out to show their faces, and they show their scars. So now breast cancer has been exposed. Our youngest patient was a 13-year-old girl.
Wow.
At the age of 13, she had intermediate phyllodes tumor. We had to do bilateral mastectomy. She is 18 years now. And at the age of 18, she is a complete woman. She even unfortunately delivered this year. 18 years, but she has a first baby. Unfortunately, the men couldn't spare her.
Then, doctor, you are doing a great job in Ghana, and we all need to support Dr. WIAFE for this initiative. Doctor,
let me say a very big thank you through your medium to all the people, the individuals and the partners we have who have been supporting us. In fact, we are here because Kempinski Hotel Goko City is our partner, and so they gave us this nice room to do our meeting, and so we thank them for their partnership and sponsorship. There are a lot of things that we need to do to improve the survivorship, to improve what we can do to help our people. Individuals can help. Companies, corporate Ghana can all help.
Thank you very much, Dr. WIAFE, for coming to Mr. WOODE Studios for this useful information. We thank you for watching Mr. WOODE Studios. Subscribe, like and comment. We have more important episodes for you. Thank you very much. Doctor, your final statement.
I want to tell our Ghanaian women especially, that you are special. You have lots of responsibilities. The family depends on you. Unfortunately, breast cancer is striking earlier, and so we should be more aware of our breasts. We shouldn't think that the disease is caused by witchcraft. We should know how our breasts look like and how they feel like. Let's start doing our own breast self-examination, and if we see anything, let's go to the hospital. Breast cancer is a hospital disease. It's not a spiritual disease. Despite the presence of breast cancer, you can survive and take care of your children and your family, and also continue with your life. Even if you have to sacrifice one breast or even both breasts to breast cancer, do sacrifice, do give the disease out and stay to take care of your children and your family. We all have it as a duty to stay alive and contribute our quota to Mother Ghana. Thank you.
Thank you very much, Doctor.
Thank you.